Is next.
Mr. Secretary, for years, communities across the country have struggled to fill major provider workforce gaps, a growing crisis exacerbated by the pandemic. Based on my legislation, Congress authorized the creation of 1,000 new Medicare-funded graduate medical education slots in the Consolidated Appropriations Act of 2021 and outlined specific criteria for distributing these slots. However, CMS has repeatedly included additional criteria not specified in the law, which unfairly disadvantages many states, including New Jersey. Since enactment, there have been 2 rounds of distribution for these slots, meaning we are 40% of the way through the program, and New Jersey continues to be completely shut out. It's been years, and we still don't have an answer as to how we get positions to teaching hospitals in my state. The law clearly specifies that the Secretary shall, not may, shall distribute residency positions to each of 4 specified categories of providers. So what can you commit to doing to help ensure that states are no longer unfairly shut out of the program in contravention to the way the law is written?
Senator, appreciate the question because I know that this has been one you've worked on for quite some time, and our team has been trying to be responsive to your staff as well. As you know, New Jersey, like California, the circumstances sometimes make it difficult for some regions to be able to qualify for some of the resources, and in this case, GME slots. We're more than willing to work with your team, but the resolution is not so simple because as you try to resolve the issues that affect states like New Jersey or California, you create other issues for other states.
Well, let me interrupt you because it's not so difficult. The law is clear. It is CMS, the Kingdom of CMS, that has decided to add additional criteria that Congress did not stipulate. I'm sure when you were a member of the House and the Ways and Means Committee, you really appreciated when federal agencies changed the law that you helped pass and enacted it in a way that was not your intention. That's exactly what's happening here. Exactly what's happening here. And I think you have the power to fulfill the law as it says the Secretary shall distribute residency provisions in accordance with the law. This is not happening in accordance with the law. And so this suggestion that the department is trying to be cooperative and helpful, it falls far short on me. I hope we can find a better way forward. Last month, your agency's Inspector General issued a concerning report finding that over a few-month period, 16% of unaccompanied migrant children files lacked any kind of sponsor background checks. It also found that in nearly 20% of cases where unaccompanied minors were released to sponsors pending a background check, there was no documentation confirming those checks were ever completed. Given the alarming pipeline of unaccompanied migrant children being released into situations where they are ruthlessly exploited for their labor, this is a glaring blind spot that needs to be addressed. Extrapolating from the report, we're talking about potentially thousands of migrant children who are sent to unvetted sponsors. As the report concludes, the failure to complete background checks increased children's risk of being released to unsafe sponsors. What specific actions have your agency taken in response to the finding of the Inspector General's report? And how is your agency working to ensure that expeditiously finding sponsors for unaccompanied migrant children does not come at the cost of their safety and well-being?
Senator, I can assure you that most of the recommendations that were made by the Inspector General for incidents, you're referring to incidents that occurred back in spring of 2021, a 2 or 3 month period. I can assure you that what was being observed by the Inspector General back then is not the case today. If you recall, at that point, we had an infrastructure that had been virtually dismantled. We had to stand it up, and at that point, we were dealing with an influx of children.
So today we would find none of this, is what you're telling me.
You would find that we are now doing all the background checks. We're doing thorough assessment of anyone who's seeking to become a vetted sponsor.
I look forward to seeing that as a reality. Finally, a recent Supreme Court decision has upended vital protections of ESRD patients, protections that Congress passed 40 years ago through the Medicare Secondary Payer Act. I'm proud to partner with Senator Cassidy on a bill to amend that act and protect patients living with ESRD from discrimination by private health insurance plans. But unfortunately, we're not able to get your agency to work with us to fix this problem. Will you commit to CMS working with my staff and Senator Cassidy's staff to have the appropriate information we need to address this problem?
I absolutely commit to make sure that our staff is working with your and Senator Cassidy's staff, and I know that we've been engaged with some of the folks on this particular issue.
Thank you, Mr. Chairman.
Senator Cornyn.